can obtain it, right? Hey, Franklin.
What does it do, yo? It gets me high.
Up to the sky, right?
Oh, when I pick up his foot. Come on and tell me what you want to do.
Yeah, you're definitely on Joy 99.7 FM. Program is Ultimate Health, your ultimate guide to healthy living. This night is Sunday 2:05. As you can see, we're alive.
Put your hands together. Come on, put your hands together.
Brother, can't you see? I've got the victory.
Now, young people, if you don't mind, I feel like having a little church in here. Because the devil is alive, because he's a Messiah, going to another level. Come on. So, can you help me?
When I think about the goodness and the fullness of God, make me thankful, pity, the hateful, I'm grateful. The Lord brought me through this far. I'm trying to be cute when I praise Him, raise Him high. I keep it live, beat bumping,
Give the Lord something.
make the Lord feel something.
That's right.
Ain't no shame in my game, God's property. Getting big with church, ain't no stopping.
GP, are you with me? GP is actually God's property, right?
Notorious.
All right, naughty by nature, notoriously naughty. Right here, Ultimate Health on Joy 99.7 FM, 14th of November, World Diabetes Day. The numbers are rising. The specialists are concerned. Do you know your numbers? That's why I'm upbeat, eh? Diabetes goes everywhere blood goes. Your eyes, your kidneys, your feet. You name it, I've got her. Consultant physician and endocrinologist at the Trust Hospitals Company Limited, Dr. Chris Adai. He's the one person I would love to do diabetes with. And as I think back, God, way back, Dr. Kwamina Beecham, I think Professor Francis Ofer has also been head of the association at some point. We've done some work, huh? Chris, good to have you.
Great to be back.
Right, I'm not getting you on my mic. Good to have you.
Great to be back.
Last time I had you, we had a little fender bender after leaving my studio. I feel so bad, eh?
Oh.
Some of my resource persons make so many sacrifices to be in the studio. Chris left me and then he sent me a picture. I said, oh, what has happened? Chris, thank you so much for being here.
You're welcome.
Right, just move the mic a bit closer to you.
Okay.
So the last time you were here, you were at the Trust Hospitals Limited as a consultant physician or physician specialist, and you were a fellow in training, so to speak, at the Kolebu Teaching Hospital.
Yes, you are right.
I did my flyer and I put the old status. The levels have changed. You are now fully. What?
Fully fledged endocrinologist.
Endocrinologist. Please tell my listeners what an endocrinologist is.
Okay, so an endocrinologist is a doctor who deals with the disorders of the endocrine system or the hormonal system.
Thank you.
Let me put it that way.
Under that umbrella,
Yes.
please, when I use umbrella, I'm speaking English. Under that umbrella falls diabetes.
Yes.
Right.
Yes.
Right.
In fact, it's the commonest endocrine disorder. So
Diabetes,
it can even stand on its own because
Right.
it's such a big thing.
Right, folks. Diabetes is an endocrine disorder. That's why I love having Chris and his kind in the studio. Grateful you joined me.
Thank you.
What did you get? You always come in a t-shirt you didn't give me. Right?
You never ask.
And you go for walks, you don't invite me. But I see everything you guys are doing, and the local association. IDF is international.
Yes.
Right? And
yes.
local is what?
DEMSOC.
Yes.
Right. Diabetes Endocrine and Metabolic Society of Ghana.
Right. Okay. Let's start. Every year, and I've done this for so many years, but every year it seems as if you don't need to define what diabetes is. But let's do that.
Okay. So, just by way of a recap, so as you have said, diabetes is an endocrine disorder, but I must also qualify that it is chronic. And when we say something is chronic, it means it is long-standing. Okay, that is important. Yes, it's not acute like malaria.
A chronic endocrine disorder.
Yes. In which the body has a problem handling glucose. Okay, so let me put it that way. The hormone that helps us to handle glucose, which is insulin, is either lacking or is not very
being
effective.
produced.
Yes,
Right.
either
So-
you don't produce it or it's not effective.
Okay.
What you are producing is not
Okay,
effective.
let's break it down, right?
Yes.
There's type 1, type 2.
Yes.
Type 1 is that your body does not produce the insulin
at all.
at all.
Yes.
All right? And insulin
Yes.
has a job. We'll get to that in a bit.
Yes.
Right? Your body doesn't produce it. So that in itself makes it difficult for the body to do what insulin is supposed to help it do.
Exactly.
Okay. So that is type 1 diabetes.
Yes.
Okay? Right. So if you had type 1, it means you were born with a deficiency of the system such that it does not produce this important substance. Let me call it that for now for my listeners. Insulin.
Okay. So I wouldn't say necessarily born.
Okay.
But yes, even in the neonatal period,
Okay.
some people can develop diabetes.
Okay.
But you still develop it even along the way. An adult can even develop type
So you
1.
develop the deficiency or the inability to produce
Yes.
insulin.
Yes.
Therefore, you'll be type 1.
Yes.
Okay.
So it's like if it were a factory.
Yeah.
Let's say the factory has been bombed. Okay, so you are not producing anything at all from the factory.
Okay.
You know.
Right. But initially, you had the factory.
Yes, you had a factory.
So you don't have to be like, I went into it too deep. It doesn't mean you were born with a deficiency.
Not necessarily.
But the
even though there are types that we call neonatal diabetes. A neonate is somebody who has been born within the 1 month and you can develop it.
Okay.
Yeah.
Right. Okay. And then you can lose the capacity or the ability to produce insulin.
Yes.
Okay. And then type 2.
So type 2, the factory, using the factory analogy, the factory has become inefficient.
Okay.
So if when it was built brand new, it was producing 100 cartons of milk a day.
Okay.
Now it's producing, let's say, 40 or 50 cartons.
Less of this insulin we're
Yes.
talking about.
Yes.
Okay.
Yes.
And is it the same as saying that your body is not responding to insulin in type 2?
Okay. So there are two aspects.
Okay.
You are either not producing enough, or even what you have produced is the body is not responding well.
Okay.
So that is where we talk about the resistance to the action of the insulin.
Great stuff. All right. You see, we're very serious here, even on a Sunday. If you just joined us 17 minutes past the hour 2 on Joy 99.7 FM, the program is called Ultimate Health, your ultimate guide to healthy living, right? And I've got in the studio Dr. Chris Adai. He's with the Trust Hospitals, right? It's a range of hospitals, right? The Trust Hospitals Company Limited. Okay? Yeah. It's for us. We are SNIT actually, but that's the business they're doing there. And he's a consultant physician and endocrinologist. Okay? Diabetes is a chronic endocrine disorder. We've broken down the types. If you have any questions, concerns, please. My WhatsApp is 055 11 11 997. We're live on FB, that is Facebook, YouTube, and X. Right? They used to say Twitter. Right? Okay? So, basics. We've done the basics.
Yes.
Okay. Now, I've mentioned in my topic or title, I've looked at the global theme as well, right? The numbers are, should I say, frightening us in many ways,
Yes.
right?
Yeah.
The numbers are increasing and are projected to increase over the next projected 10, 15 years. And those projections don't look good. Chris, tell us about these projections and the numbers.
All right. So like you said, as for the numbers, they really don't look good. Currently, there are about 589 million people living with diabetes globally.
Worldwide.
Yes,
Okay.
globally. And in the next 25 years, it's projected to increase to about 853 million.
Even if we are doing good work.
Yes, all things being equal.
All things being equal, we
Yes.
expect the number of persons afflicted by diabetes to increase
Yes.
almost exponentially.
Yes.
That is global.
Yes.
Come home.
And then if you come to Africa, coming home.
All right.
So currently there are about 24 million people in Africa with diabetes.
Right.
But for the next 20, 25 years, Africa is projected to have the greatest increase, about 142%
Right.
to about 55 to 60 million.
This is not an increase in donor aid,
Not at all.
an increase
In human beings. You see,
human
when we talk
beings-
about these things, it looks like it's just statistics.
numbers.
We are talking about human beings.
and human lives,
Yes.
human opportunities,
Yes.
right?
Yes.
That are affected by diabetes.
Yes.
This condition we're talking about,
Yes.
right? So the impact of this increase is going to be disproportionately distributed across the globe, and Africa gets the chunk.
You are right.
So we as Africans must be taking this seriously.
Definitely.
Okay.
Definitely.
Now I started by saying that diabetes goes everywhere blood goes.
Yeah.
Okay. So the implications are dire.
Yeah.
All right. So what does it mean to be diabetic? When you say somebody is diabetic, let's look at what you are looking for as a clinician to diagnose, and then what it means for you as a human being if you are diabetic.
Okay. So I like the fact that you said wherever blood goes, diabetes goes.
Yeah, man.
Yes, because the high sugar is in the blood.
Okay.
And you see, in the human body, everything is within a range. Okay, we have a lower limit, we have an upper limit.
Okay.
And the body tries very hard to keep everything within this limit. If it goes way up above the upper limit, it's not good. If it goes way below 2, it's not good.
Right.
But in diabetes, the sugar goes way above.
Okay.
And then since blood goes everywhere, then the damage can occur in every organ.
Okay, I like that. But you see, on radio, TV, anywhere, when you say sugar, it brings all sorts of implications, interpretations, and
Yes,
so on.
yes.
So what do you really mean when you say sugar in association with diabetes?
Okay.
Right? When you say sugar, is it the sugar you and I know?
All right.
Right? Because we know we break down food substances.
Sure.
Right?
Sure.
So can we break that down? This sugar that you're saying, you're talking
Okay.
about as a key ingredient or in our understanding of diabetes.
Okay, I like that. So there are several types of sugar. You know, normally when we talk about sugar in diabetes, we are talking about glucose.
Glucose.
And glucose is simply the most basic form of carbohydrate.
Energy.
Energy. All the bangkun and the yam and the rice and the kenke and the fufu that we eat, the body will break it down ultimately, like ultimate health, into glucose. So the glucose is the basic building blocks. So if we take this building as the carbohydrate, the individual blocks would be the glucose. So when everything is stripped down to the barest minimum, we would have this building made up of individual blocks.
Okay.
And that is what we are talking about.
Okay.
Okay.
Right.
So sometimes, I like the way you put it. Sometimes people will tell you, doctor, I don't take sugar.
Right.
So how come I have diabetes? So it's not the usual, it's not just the common table sugar we are talking about.
The end product of the breakdown of the food you take.
The end product of the breakdown of the food that you take.
Glucose.
And you cannot say you don't take carbohydrate because all the foods that we eat, we have carbohydrate in.
Okay. All right. So wherever you're sitting, including you, Philip Nye of Joy FM, I know you won an award. Congrats to the Showbiz A to Z team. All your sickly. Yesterday I heard Uncle Ken say that your surname is not even Nye. Look at you. We walked around here with a screensaver. Anyway, sugar, glucose.
Yeah.
We need to understand that, right? Most of the things, in fact, there was a time the beer companies in Ghana were fighting over which brand of beer has more sugar and which is cold filtered and which is this, because people were shifting their preferences based on this whole process, right? So when we're talking about sugar in diabetes, this is what we're talking about. That energy unit that your body needs and uses, that breakdown product is what we're talking about. Okay, Chris, tell me a bit about insulin. It has come up, right? In relation to this whole glucose breakdown and all that, what is so important about insulin that when my body is not responding to it properly or not producing it in the quantities I need, what is so important about insulin and what is it?
Okay, so insulin is a messenger. Okay. I'll use this very simple analogy. We are in this room. There is a door, and the door has a lock and a key. So if you take the insulin as the key, that is what helps us to unlock this door so we can come in here. So in the same vein, when you have eaten your bankun or fufu or kenke, and you have broken it down into the glucose, as I have explained, the glucose has to enter the cell for the cell to be able to use it for energy.
It needs a key.
It needs a key to open the door for it to go in.
Okay, I like that.
And so the insulin is the key. And so when you don't have enough of it, or if it is deficient such that it cannot open the door, then the glucose will stay outside the cell and you will not
And
have
cause trouble.
exactly.
And cause trouble.
Exactly. It's not going where it's supposed to go.
Right.
And it's staying outside and causing trouble.
Okie dokie. You're hearing this on Joy 99.7 FM, 25 minutes past the hour of 2 on Joy 99.7 FM. My producer, Ziggy, please, I need a certain key from you. Draw closer. I need insulin from you. Come. Arrive your body. Yeah. So, yeah, we're live on Facebook, live on YouTube and X. I'm honored to have Chris Adai in the studio. He's a doctor. With the Trust Hospitals Limited. He's a consultant physician and an endocrinologist. Please, if you had a problem pronouncing that, we know where you are from, right? But you are still tuned to Joy FM, right? This is serious business because the families afflicted by diabetes already on our continent.
Joy 99.7
It's
FM.
phenomenal. But when you come to Ghana and you look at the picture, please, if you have your family and you are touched by this, please, send a WhatsApp. I really need to know so that we can break down prevalence, incidence, figures into real families with names. Yeah. Then you start seeing, right? And indeed, even as a cause of premature death, Phil, it's a league leader. It's leading a league of premature death, right? So we need to take this seriously. Okay, so this is what insulin is. It's a key.
Yeah.
When you have it, then your body can make greater use, proper use of the food you've taken in. Yeah. Okay, right. And when it stays outside, it is damaging the system.
Yeah.
Right?
Yeah.
Okay. So your ability to, leverage insulin and use the energy units that are generated by the food you eat is a critical component of your wellness.
Very.
And based on the types of food you eat, you may have more glucose outside the gates than others.
Exactly.
Right?
Exactly.
That is where also diet comes in and many other things.
Exactly.
Wow.
Exactly.
Wow. And this year's theme for my listeners, right? We're looking at the impact of diabetes across different stages of life. Break that down for my listeners. What does it mean? Does it mean that if I'm a child and I have diabetes, the impact will be different from if I'm in my middle ages, productive years, and I'm working, and so on and so on? What does it mean across the stages of life? What is the import and intent of the theme?
All right. So, yes. Regarding the stages of life, so like you have said, basically diabetes is type 1 and type 2. Okay. There are several others, gestational, etc. But we just want to limit it.
Gestational is pregnancy related.
Exactly.
Okay.
For simplicity of discussion, we just want to focus on type 1 and type 2.
Okay.
So children usually have type 1 diabetes. Mm-hmm. So you have about 90% of children with diabetes having type 1.
A deficiency in the production.
Exactly. And then about 10% of them would have type 2.
Okay.
Then when you move into adulthood, then the statistics is reversed.
Okay.
You have about 90% of adults with type 2 diabetes.
Right.
And then less than 10% with type 1.
Okay.
So straight away, you know that most children would require insulin for their management.
Which means we need to introduce insulin externally into the body.
Exactly. Without insulin, you cannot survive type 1 diabetes. Tablets will not work because, like I said, there is absolute deficiency of insulin, and so you need insulin.
Chris, I beg. I hire a roadside.
Yes.
When you say you cannot survive, what are you saying? You're saying that if I have type 1 diabetes,
yes,
and I'm not being given, my body is not receiving insulin.
Yes.
That is not produced by the body. I need it externally.
Yes.
Right? And it's not tablets matter.
No.
Right.
No.
What will happen when you say you cannot survive?
You will die. You will die. Let's be blunt.
Oh.
The point is that I have already explained what the insulin does.
Without it.
So without it.
Without processing glucose the way it should.
Yes.
You will die.
You will not have energy to do anything.
You will die.
As we sit here, we are breathing. We are moving our muscles and all that.
Amen.
It's energy
Joy.
that we use to do that. So
Right.
if you do not have energy, you
Right.
cannot survive.
Okay.
You
will
cannot
die.
survive. Yes, you
That
will.
is why they require insulin.
Exactly.
And when you say it is not tablets matter,
Yes.
tell us what that means.
Okay. So insulin is a protein,
Yeah.
Loosely, let's say it's like meat.
Okay.
So if we were to make it into a tablet and give it to you to swallow, Your body will digest it as if you just ate meat.
So to go through the whole process
So you will not get the effect. And that is why we need to bypass the stomach
and give it to you direct.
and give it to you directly. You know, otherwise it will not work.
Straight to headquarters.
Exactly.
For processing.
Exactly.
Right. Okay.
Exactly.
You're hearing all this breakdown on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, we're talking about assessing the impact of the rising numbers, which all specialists have said, as part of their celebration or observation of World Diabetes Day, is alarming, right? And then they also want us to bring our focus to addressing the impact of diabetes across the stages of life. If you have it, and Chris rightly, emphatically said, it is a chronic endocrine disorder, so it's not going away. So if you have it, it is with you for life. Yeah, I'll come to whether there's a cure or not, because there are people walking around saying all sorts of things, right? But it is with you for life, and hence this validates or justifies the assessment over time, right?
Yeah.
Because your management will need to change over time. Your awareness and your deliberate compliance with certain modifications in your lifestyle will need to be serious and focused and disciplined over time, right?
Yes.
Wow. Okay. Is there anything you would have put better?
You've said it. So like I said, for the children,
So give me your qualification.
Pardon?
Give me your qualification.
Oh.
If I say it as you say it.
Joy 99.7
Right.
FM.
So this is what we are saying.
Yes.
If you have a child who has type 1 diabetes,
Yes.
there must be intervention. Straight.
Yes.
But, Chris, let me ask you this. Let me put it this way, ignorantly put. So is everybody who has diabetes aware of it?
You've asked a very good question. In fact, all these statistics that we are talking about,
We're talking about people.
more than half of the people do not know that
They don't know.
They don't know that they have it. Because you see, especially for type 2 diabetes, it usually does not cause symptoms.
Joy
The type 1,
99.7
once you
FM.
don't have the insulin at all, the symptoms can be quite dramatic.
You struggle.
It will be dramatic. You would lose so much weight, you will pass so much urine, you will drink lots of water. So that one, you can't go for any long period of time without reporting to the hospital for us to really make the diagnosis.
Right.
But for the type 2 diabetes, you can go several years and it's not
And
causing...
not know it is there.
Exactly.
But you are part of the numbers we are claiming are...
And the fact that you
increasing.
do not have symptoms does not mean it is not causing damage. It is still causing the damage to the eyes, to the kidneys, to the heart, to the brain,
All right.
and the feet. It's causing damage.
Okay.
In fact, for some people, the first time they get to know they have diabetes is when they have a stroke or a heart attack, and they are sent to the hospital and the diagnosis is made.
So it actually has bedfellows, stroke, heart attack, diabetes.
Yes.
There's some, what is it called now? Triumvirates that we don't want to hear.
In fact, so we call them the complications, and that is why we worry so much about these conditions.
Right.
It's the complications that they
Even
can
on
cause.
its own, it is trouble.
Yes.
But in conjunction,
When it brings its brothers and sisters, the hypertension, the high blood cholesterol,
99.7 FM.
and then I refer to them as the unholy trinity. They do very
Trinity is the word I was looking for.
unholy.
I
Yes,
said triumvirate.
it is an unholy one.
Please. I know those days, what's Batman, Cocovelli, and they were called the Trinity. I forgot. Was it? Oh. All right. This is not showbiz A to Z. But please give us, what is the Trinity when we're talking these disorders?
So usually you don't have diabetes alone. Usually most people with diabetes, they would have either hypertension and or high blood cholesterol in addition, especially for the type 2. You know, because there's what we call the common soil hypothesis.
Right.
It's like the risk factors for these conditions are common to all of them. Because if you take obesity, for instance, which is a major risk factor, the obesity on its own will lead to the diabetes.
Please, when you say it obesity, it doesn't work that well. It doesn't go that far.
Yeah.
If it was social media, they will measure the reach of a platform like Instagram. When you say obolosity, right? If you are obese, then you've passed chubby, right? You have more flesh on your frame.
Yes,
than
for
you
your
should have.
height.
Right. Okay.
So, yes.
So obesity moves and walks with diabetes,
Hypertension and high blood
Hypertension.
cholesterol.
cholesterol.
So most of the time, you would see most people with either 2 or all these 3.
Okay.
Yes.
All right.
99.7
Okay.
FM.
Let me, give you the insulin key, right? The key to ultimate health, and I call it insulin for today, is 030-221-6541. 030-221-6541. The other key, still insulin, is 055-11-11-997. We're doing serious dissection of diabetes across the stages of life, right? With Dr. Chris Adai. Do I pronounce it? Some say Adai.
Adai.
Adai, yeah,
Yes.
okay, right, yeah. Consultant physician and endocrinologist with the Trust Hospitals Company Limited. Serious mind, though. I don't bring small minds into the studio.
And a member of DEMSOC.
And a member of DEMSOC, which is painfully
Diabetes, Endocrine and Metabolic Society of Ghana.
okie dokie, right? We're talking about. Should I use disorder? Yeah.
Yes,
Or-
it's a disorder.
It's a disorder.
It's a disorder.
Right? That touches many families. Okay, even if it doesn't touch your family, when you marry and go downstream, you meet someone, right? And we need to understand it so that we can manage it. I'm using the word management, Chris. Maybe you will correct me later, because
No, that
people
is-
want to talk about cure. Anytime I bring a program up, a topic, the people want to hear into yet to me sign. Is that the tree?
Yeah, you to me too nasty.
Can we? Is there a cure for diabetes?
Well, for now, I would say no. You know, any cure is experimental now.
Okay, what
you
about now? Is Sunday? What about Monday? There is no cure
There is no cure.
anywhere across
If
the
we,
world.
if we find one, we will let everybody
Please say
know.
this emphatically, because
There-
I
there
have
is-
people who go all sorts of places. They hear all sorts of things.
I know.
And you and I in the clinical fields, right?
Yes.
The care field, we know people will leave us and go to all sorts of prophets and other things.
Yes, because they promised them cure.
Please say it emphatically.
There is no cure for now. We are still doing
For what?
research for diabetes. We are doing research. When we get a cure, we will let everybody know.
Okay.
For now, there is no cure.
I like it when my guests, they blunt, right? When we say you die, he said blunt. Right? And that when they are cutting you with something blunt, it's even more painful. It's still a cut, right? But with the sharp one, it's different, right? Any questions, concerns, experiences, testimonies, 055 11 997, Ultimate Health on Joy 99.7 FM. So if you have type 1, the symptoms will show.
Yes.
Please mention some of them. You mentioned it, drinking water, losing weight, but just capture it for us
Okay.
in a crucible.
All right. So you would be losing a lot of weight. You'll be passing a lot of water, as in urine.
Okay.
And then because you are losing so much water through the urine, you will be very thirsty. And then that would force you to drink a lot of water.
Okay.
Okay. When you have wounds, they heal poorly.
Excessive thirst, and you're
Yes.
passing a lot of
Urine.
Okay.
Yes. When you have wounds, they heal poorly. You may be prone to repeated infections.
Okay.
You know,
Why do the wounds heal poorly?
Okay, so you see, we normally talk about the glucose or the carbohydrates, but the insulin also works on protein and then fats and oils.
Okay.
It's just that it's easy to measure the glucose, and that's why we focus on it.
All right.
So you also need
It's a good marker for measuring.
exactly. You also need protein.
Okay.
You know, for wound healing and all those things.
Okay.
So when you don't have the insulin, you also have a problem with the protein synthesis ahead, forming the protein, and therefore
Okay.
you would have poor wound healing
Okay.
and all that. Your immune system is also affected
It's also
because
compromised.
all those antibodies are also made up from protein. They are
Okay.
made of protein. So repeated infections and all that.
Okay. Many of you may be connecting, my discerning listeners, with slow or non-healing ulcers, and then the downstream amputations and the things that are needed.
Yeah.
Okay. Yeah. You're with us. Okay. Somebody said something about his birthday announcement. Hey, no. Honorable Banafo Emmanuel Afenyo, Junior Afenyo. Okay. Happy birthday. I can't read your message. Good evening, Adobia. Hey, what is this, Adobia? Please, what IP? No. Hayford in Bato, please send your thing again. Maybe you send Adobia's message to Ultimate Health. Good afternoon, Nortey. How are you and Doc, please? What happens before the body may not produce insulin? So this is Hayford in Bato. Okay. And then the factory business we talked about. Good afternoon. Welcome to my home, Oye in Afenya. I'm always humbled when you send that. Then there was something else. I saw somebody else type. Right. Good afternoon, Nortey. Okay, that's Hayford about inability to produce. Nortey, can diabetes be hereditary? Can you inherit, right? Or is there a genetic familial connection to diabetes, right? So this is somebody's asking that. And more so, when one stops sugary food entirely, even fruits, can one still suffer from diabetes? Oh, Kwame in Dansoman. Oh, Hamio. We went into Banku, another wine, and breakdown of foods. But Chris, instead of laughing, let's share with Kwame. And then Hayford wants to know what will stop the body from producing insulin. Yeah.
Okay. In fact, with the last one, I think you've answered it.
Okay.
You know, the carbohydrates getting broken down. So the fact that you don't eat sugar directly, it doesn't mean you cannot get it.
Okay.
So I think you've answered that one.
Okay.
And then I think you talked about the genetic one. Yes, so there is what we call monogenic diabetes.
Okay.
But that constitutes a very small percentage,
Okay.
you know. So it can run in families for some, but
Okay.
that is not very
Okay.
common.
Great stuff.
That's
Okay.
not common.
Right.
And then regarding the how you are not able to produce,
Right.
yes. So they are for the type 1, for instance, in the children. We realize that, you know, they talk about breastfeeding rather than baby foods and all those things. Sometimes you produce certain proteins that react. The body recognizes. The body is able to recognize what is self and what is not self. And sometimes with all these things, especially in that early period when you are not breastfeeding, you are doing something else,
Okay.
the body can be confused, and then it will attack the cells in the pancreas where you produce the insulin.
Okay.
And that is why you can have even babies 1 month,
Right.
2 months developing that one.
Okay.
Aha.
Okay.
But for the adults, usually it's like they get tired. So when you keep on whipping a horse, because there's resistance to the insulin. And so the body tries to produce more to overcome the resistance. But you can only do so much.
Okay.
After some time, you get worn out.
Great stuff, Dr. Adai. All right. This one says, Ni, good afternoon. I'm Nyamiye, listening from Agona Swedru. Thanks for educating us all the time. But I know someone who has been able to reverse diabetes with diet and exercise, and he's super healthy for the past 4 years. Okay. Now, Doc, what do you say to that?
Okay. So there's something we call remission of diabetes, type 2 diabetes, remission. I think that's what he's talking about.
Okay.
You know, we talked about the risk factors, the obesity, the sedentary lifestyle, the poor diet, and all that. So I have a few of such patients.
Okay.
Very determined. If you lose significant weight, more than 10-15%, and you change your lifestyle, you're physically active and all that, you can push the diabetes into what we call remission or reversal. But it is not cure. That's what I want to
See
emphasize.
the way I'm looking at you?
Yes.
This look of mine is called sign language eye. Sign language eye. The reason
Yes.
I'm looking at you is, so for those people, would we say they were conclusively diabetic? Because I know there's some pre-diabetic in terms of your numbers and many other things.
Oh, yes. As for the diagnosis, it's not difficult.
It's
There
not
are just some
difficult.
cutoff points once you meet them.
Okay.
Yes.
So you're saying these people who can't go into remission on lifestyle changes,
Yes.
right?
Yes.
The diabetes has decided to go silent, vibrate
Yes.
only.
But when you stop those things, it comes back.
Okay.
That is why we call it reversal or remission.
Remission, not
Yes,
cure.
not cure.
Okay.
Cure means that no matter what you do, it won't come back again.
Great stuff.
That is not
great
it.
stuff. So we are not recollating,
Yes.
right?
Yes.
The vote has been cast. You are
Yes.
diabetic,
Yes.
right? It has
Yes.
gone into remission,
Yeah.
right, or reversal, but you have not been cured. Nyamiye, educate everybody in Agona Redru. You heard it on Joy 99.7 FM. Good afternoon, Ultimate Health. Can someone with type 1 diabetes have high glucose level? I'm from La. I'm not.
Oh yeah, the diabetes is high blood glucose.
Yeah.
Unless
Okay.
I'm not getting hit.
Okay, Amma. Confirmed. Okay. Togby says what? What is this one? Okay, I'm not getting. Hello, Nortey. How far? No, wait. Hello, Ni. I'm type 2 the past 2 years. I am 73 years old. The past 1 month, I've been experiencing intermittent severe burning of the feet. Is it part of the diabetic condition? What is the control? Togby is asking.
Okay. So he likely has what we call a diabetic neuropathy.
Neuropathy.
Yes. So the nerves are being affected, and that is what is giving rise to those sensations.
Okay.
Yes. So the best form of treating that is to ensure that there's strict glucose control.
All right.
But beyond that, we have drugs to help.
His numbers must be strictly within certain limits.
Yes.
Based on control.
Yes.
Okay. And
Yes.
that one you're talking about oral meds. Oh?
Most likely, yes. Most type 2 diabetes patients are on oral medications.
Okay.
Even though after some time, some of them may need insulin to support the drugs.
Okay.
Yes.
Now let me ask you again, alongside Togbi, burning sensation or severe burning of the feet. It suggests to me heat, right?
Yes.
Or a sensation of heat.
Yes.
Okay. But when you bring in nerves, then people start to think, Nancy, what, how do you describe this thing? He's captured it as burning sensation of the feet, right?
Yes.
Is-
Okay.
Is there a way you can capture it for us?
Okay, so sometimes when it comes to nerve issues, I want to use this analogy for people to understand.
Great. Right.
You have your brain, which is equivalent to the Akosombo hydroelectric dam station, the powerhouse, where we generate the electricity.
Okay.
Then your brain continues as your spinal cord. So let's take that one as the transmission lines from Akosombo coming.
Gridco.
Exactly.
All right.
Transmission lines.
Right.
Then the nerves would be the final wires that come to your house. Okay. So you can have a problem along any of the lines.
Okay.
You know. And for this one, it is the final wire that comes to your house.
Right.
Okay. And these nerves, they make us sense pain, temperature. You can tell something is hot or cold.
Right.
You can tell something is painful, sharp, all those things. It is when they are affected with all this high blood sugar that they begin to give you all manner of sensations.
Okay.
It can be a heat sensation. It can be as if you have pins and needles sensation. It's as if sometimes they tell you it's like I'm walking on foam.
Okay.
Doctor, as a mitieti afufoso, as a nsuo woho, those kind of things. So it's the sensations from the disorder in the nerve.
Diabetic
That gives-
neuropathy.
yes. Nerve,
Diabetic.
yes. A neuropathy is a nerve damage.
No, I want to use the terms.
The terms, yes.
right,
Neuropathy.
So that
Yes.
somewhere along the line you give me a
The
clarification.
academy. Yes,
okay.
the academy.
The academy will accept
Yes.
me. Okay, so Togbi, that is what is happening. And you said he should have strictly controlled sugar levels.
Yes. And then we also have drugs to control it. So he should
medication.
see his doctor.
Okay, dokie.
Yes.
All right, let me see. Charlie, there's a burning sensation on my WhatsApp, Chris. Good afternoon, Nortey. Please, can regular dry fasting and exercise influence, the word is influence, diabetes? And what does oral drug metformin, right, you had a G, it's metformin, right, do in controlling diabetes? So she wants, it's a he, Paul from Adenta Sakura. He wants to understand if dry fasting, right, can and exercise combined can influence diabetes, right? And then he's also asking, what at all does this metformin do? Because I have many people who think that, or they've heard, oh, jai way, naya way, drink this, boil this, and drink this. It is equal or equivalent to metformin.
Oh, okay.
Right? Now, the combination, because of the triumvirate and the Kofi Pobi, or is it, yeah? He sent me the triumvirate. Batman, Cocovelli, and KK Fusu. That's right. The Trinity. right. All right. Okay. Thank you so much. Been a while. Right. So when you have the Trinity, you're buying a lot of medications. So when they hear anything else, dry fasting or this, it seems a workable, manageable alternative. So dry fasting and exercise, can it influence diabetes? And then metformin, what is its mode of action? What does it do in controlling diabetes?
Okay. Exercise, yes. In fact, in managing diabetes, I always talk about the 4 pillars, like the 4 legs of a table.
Okay.
I talk about diet. I talk about exercise or physical activity. I talk about the education, which is what we are doing now, and then the drugs.
Okay.
So these are the 4 legs of a table, and that makes the table stable.
Right.
So yes, exercise also helps. You know, it will also lead to weight loss. Weight loss also helps control. But the issue of the dry fasting, you see, we are talking about things that are sustainable. We have said it's a chronic disorder. So I do not know how you can do dry fasting for the rest of your life. You know, so if you want to fast for religious purposes, yes, you can see your doctor.
Fasting.
You can fast.
But don't say it's controlling something.
But yes, you will not say that we are using dry fasting to control diabetes.
Okay,
that is not a practical thing.
Right, and
and for the metformin,
yeah,
yes, metformin is one of the drugs we use to control the sugar. It reduces the resistance of the body to the insulin.
Okay.
You know, we talked about resistance to the action.
So it's a locksmith. It's helping the key to
it
work.
helps, yes, it helps for you to respond better.
Okay.
Exactly.
So all these Galvusmet and all those ones, are they similar?
So Galvusmet is a combination drug with metformin and another drug.
Okay.
So we have several drugs.
Okay.
We have several drugs.
Right. You see, I got the right person in the seat, in the person of Dr. Chris Adai, consultant physician, endocrinologist with the Trust Hospitals. My phone lines are still active with the key, which is 030-221-6541. Call it insulin if you like. WhatsApp is 055 11 11 997. We are assessing the impact of these rising numbers. And these things are part of the rising numbers. If your numbers are rising, if the numbers of persons should I say, suffering or affected by diabetes,
or
living with diabetes, that's the word I was looking for, living with diabetes, then the toll, the burden is what we're talking about, okay? We've identified that if you're a child, you're most likely, right, not automatically, to be in the type 1 category, all right? And we've also started talking about type 2. Please, if you are living with diabetes, these are the buttons 030-221-6541, right? So that nobody confuses you. I brought the specialist into the studio, all right? Listen carefully and then not only be informed, but be transformed.
Joy 99.7
That's what we do here
FM.
every Sunday. And Nyamiye in Agona Street, you're most welcome. He's thanking me for the answer on reversal, right? You're most welcome. That's why we're here even on a Sunday. Okay. Kofi, the name is Kwesi from Kade. Please ask the doctor what predisposes more men to stroke than women. Okay, that was something else. Good afternoon, Nortey. My name is Kwesi from Kade. My fasting blood sugar when I checked at the hospital ranges from 4.3 to 5.7. Am I pre-diabetic? What is normal for my age? I am 45 years old. Fasting blood sugar. He's introducing terminology which I was reserving for next week because I'll do a double take on this. Right, Chris? He's asking. 45 years old.
Okay.
Fasting blood sugar.
So that is normal because from 4 to 6 is normal. And when we say fasting, it means you have not eaten for at least 8 hours.
So
at least 8
overnight.
hours. Overnight.
Okay.
Yes.
Not the people who eat tilapia and all those things 11 p.m. and something, and then in the morning they take their glucose.
Yes.
You haven't fasted.
Yes, you haven't fasted. At
for
least
long enough.
You should do like 8 hours minimum, up to about 12.
That is the criteria for fasting blood sugar.
Yes. And if you do that, the normal should be 4 to 6.
Okay.
And then when it is above 7, we say you have diabetes.
Okay.
So you notice that there's a gray area. So
Okay.
from 6.1 to 6.9 is the pre-diabetes.
Okie dokie. Right. Okay. So, Kwesi, please, we have read your pink sheet. Okay. And you are not in parliament yet. Okay. But you've got to be careful because no condition, position, status, state is permanent. It can change
either
seriously,
for the better or for the worse.
For better or for worse.
Yes.
Okay, right. I'm right. Okay. Somebody's asking something. Why feet only? Let me quickly read that. Okay. Togbu is asking, why is the burning sensation only his feet? Since we've said that diabetes goes everywhere, blood goes. Now, Togbu, I beg you, medekuo, you don't want it to go anywhere else. And if it goes to your eyes and other places, Chris will tell you, why only feet? And is it only feet?
It's not only feet. That's the commonest, but it's not only feet.
Right.
In fact, for the men with diabetes who complain about erectile dysfunction, it is the damage to the nerve that goes to the powerhouse.
In your third leg.
Yes.
Right? That
yes.
affects your erection.
Exactly.
Right?
When the nerve is damaged.
Because,
so it's not only the feet.
Because Chris said it.
Yes.
Erection is blood.
Yes.
Yes.
It's just blood.
Uh-huh.
Yes. And it also affects the hands, the fingers. So it's not only feet.
Okay.
That one is just the commonest one.
Togbe, Esegome, my Igbe is not coming. But I think Misegome means I've understood there, or do you understand?
Joy.
Yes.
Yeah?
9.7
Talk,
FM.
we are so grateful you are, listening attentively. Right. Okay. We're running out of time, but we're doing good work, and we don't want to rush this. Okay. So, if I'm in, let's say, working life, middle age, these things can affect my ability to work,
Yes.
right?
Yes.
And my life.
In fact, diabetes it's not an easy condition to live with.
Right.
We have to be frank. And that is why one of the sub themes,
99.7
is diabetes and well-being at the workplace.
At the workplace.
Because we want the workplace to be a place where people with diabetes are supported.
Okay.
I have a nurse that I work with who has type 1 diabetes.
Okay.
So you can imagine, giving yourself insulin injections about 4 times in a day
Yeah.
and working as a nurse. And if you remember the short video I sent you,
Yeah.
one of the medical doctors, a young lady medical doctor who has type 1 diabetes and is still doing her work and helping her patients. So it can really have a toll on you.
Yeah.
And that is why in the diabetes clinic, we don't only talk about the doctor. It's teamwork. I work with the dietitian, I work with the clinical psychologist, because it can take a mental toll on your health. And so there are people that I refer to the clinical psychologist to assist me to manage them.
Okay.
Yeah.
Right. Dede in Maryland. She says, hello, Dede. I've heard him mention sudden weight loss, drinking lots of water, and peeing a lot. I didn't hear him mention foamy urine. Foamy urine, which I understand is a sign of excess protein in the urine due to diabetes. Is it right or is it a myth? Some people even say go and pee and see whether ants will gather. Dede is asking.
Yes. So as for the foamy urine, you've gone far. What it means is that it could mean that there's a lot of protein in the urine, but that means that the kidney has been damaged.
It has affected your kidney.
Yes.
Right.
But I'm not saying that the protein in the urine is the only reason why urine will be foamy.
Right.
So that is why I really didn't talk about it per se.
Okay.
Because if you are really having foamy urine, and it is because of the diabetes, what it means is that the thing has gone on for a long time, has damaged the kidneys, and they become leaky, and they are allowing protein to go through. And it is that excess protein which will cause the foam. But that is not the only reason why you can have foamy urine. So if you have foamy urine, go to your doctor. Let's determine what is causing your foamy urine. But yes, it can be due to diabetes, which has affected the kidney.
Chris, diabetes only subai.
Only subai. As for subai, there only subai.
But when
Only
people
subai.
are talking about things they're afraid of, it takes some time to appear on the horizon. But
It's
why?
because it is largely asymptomatic. You see, the symptoms that I talked to you about is for those with type 1.
Yeah.
Overall, type 1 diabetes is just about 5% globally.
Tell me.
So 95% is type 2. So when we say diabetes without qualifying, actually we are talking about type 2.
Right.
And type 2 doesn't cause a lot of symptoms. And that is where the problem is. You are fine. You are big. And I said weight loss, and you are big. So you even think that you have nothing to do. But being that big is even the risk factor for the condition. But you are not getting the symptoms. That's why we talk about screening. You need to screen. When we say screening, we mean check before you get symptoms.
Right.
When we are screening a disease, it's
Screening
not when you have the symptoms. That one is not screening. It's diagnosis.
Yeah.
When you have symptoms and you report to the doctor, it's diagnosis.
Yeah.
We don't want you to have the symptoms. Do your yearly screening and let's pick the disease and stop it before it causes havoc.
Wow. When I teach, I tell people screening is presumed healthy people going through the checks.
Yes.
Right? If any of those checks give you green or are indicative, then you do further stuff, which Chris is saying that is heading towards a diagnosis. Yeah. Right? But screening protects you.
Yes.
It allows for early detection. Right?
Yeah.
So please, this is what we're saying. We'll wrap up on this for today, but this is serious business. Yes. You may have it and you don't know. You sit and drink boot for boot with your friends. Things are happening to your eyes, your feet, and things. But hey, you've never bothered to check for diabetes. Yeah. We are going to do a strict dissection across the stages. We've started. Okay, we've understood some implications for children, younger people, but I'll plead with Chief Chris so that I can get him and maybe some of his colleagues to come next week. Let's break it down. So, what you want my employer to know, and how can my employer assist me if I have diabetes, right? Is it his business at all? And won't they use it against me? And things like that. Okay, when we say diabetes at work, you want me to be productive.
Yes.
Right?
Yes.
You want me to make a meaningful contribution at work, but I have this disorder which you have educated me is chronic.
Yes.
Right?
Yes.
I don't want it to get worse,
Yes.
but it's not about to go away in a hurry.
Yeah.
Right? That's what Chris is telling us.
Yeah.
So, do we have a deal next week? Or you send me some of your children?
I'll try.
Now that
I'll
you're a
try.
big man. But I'm just, immensely grateful. All
You're
right.
welcome.
I know there are many, many of you out there, but I know Chris will respond. Chris will be here. Those of you on the other end, please, please, please. A salute for Dr. Chris Adai, consultant physician with the Trust Hospital and endocrinologist, right? Fully qualified, right? And he'll sort you out. He sorts out many people I refer to him, and there are many others like him. Okay, this is serious business. So we'll sort it out. And next week, we'll bring it back as well because, hey, that's what we do on Ultimate Health. Many thanks to my producer extraordinaire, Ziggy Badio, who will be coming with some mean music to soothe you, even if you are pre-diabetic or diabetic. What better do you want than Joy 99.7 FM? My name is Nortey by nature. I'm out. And I'll leave you with Sounds of Blackness. Change is coming. We've got to change the numbers. We've got to change the dialogue and impact on diabetes.